Weekday Morning Health Connection is a new program that we're starting through the BIC Media Labs to help various communities get connected to good, helpful tips and information that can help you stay healthy and happy through this time of crisis and beyond. I'm joined here today with Alex and Roy and Sony, and I will let them take it away here in our Zoom meeting right now. Good morning, folks. How are you?
Good morning, and thank you so much for your participation. We have Alex. How are you today, Alex?
I'm doing well.
And Roy, both are. I'm going to let you introduce yourself, Alex. I know you have helped us, and as you guys, the public knows, we already had you guys as a special guest at the Immigrant News at the Business Innovation Center. And Alex, can you tell us during this COVID and this challenge that we all are facing, how this all has impacted your life?
Yeah, absolutely. So I'm a medical student, as is Roy, and we're supposed to be rotating through the hospitals, but as medical students right now, it's not safe for us to be there just because there isn't enough protective equipment. So we're left to our own devices about what to do right now. There's a lot of uncertainty. So I'm just trying to keep busy. I'm trying to work on some research projects, trying to take care of myself, exercise regularly, stay on a pretty normal daily schedule, just so that I can maintain some kind of routine in my life. On top of that, I'm staying connected with people in my life. So my family, my friends through virtual meetings and virtual holiday celebration, which has been really lovely.
Mm-hmm. Can you tell a quick background about yourself?
Yeah, so I grew up Washington, D.C. My mom is from Brazil originally, so grew up speaking Portuguese with my mom and my grandma who lived with us at home as well. Went to college in St. Louis, Missouri, and now I'm a medical student at Brown University.
Awesome. And Alex, how this whole challenging times has affected you as a medical student?
So it has just made a lot of uncertainty is really the biggest thing, which I think is what a lot of people are facing right now. So just trying to find ways to keep busy and not let myself get bogged down by the things I can't control in this time of uncertainty.
And how about you, Roy? How can you give a little bit of your background and how this whole challenging time has affected you?
Sure. I was born in Nashville, Tennessee, grew up mostly there and Indianapolis, Indiana. I went to college at Brown University where I studied biochemistry and Portuguese, and I ended up coming back for medical school. And glad to be in Providence for another few years. Like Alex, I am a third-year medical student, so I'm likewise been removed from the clinics, which is the majority of hospitals, which is where we've been spending the majority of our time for the last 12 months. And it definitely has been quite a shift just in mindset and day-to-day living to not be doing that and not to be interacting with patients at that level. But yeah, just been trying to do similar things, work on some projects that I maybe didn't have time to before, try to stay informed, but also not overwhelm myself with the amount of media that's being circulated, keeping in touch with old friends, getting back to hobbies that I may not have made time for before.
And that is a great point. How would you, because that seems like it has been working for you, meditation and working on things that you haven't had a chance to do it before. Now, relating to the immigrants and relating to especially families of migrants that are living in this community that we have been in contact, what would be like some pointers that you would give it to them for them to face also this hard time at home? Roy.
I would say, that are like, we still are living our lives the best we can, and I think a lot of the recommendations that you would normally get from a physician or anyone else who's offering life advice kind of stay the same. It's good to maintain a schedule, like Alex was saying, have a way to know that like a day is starting and a day is ending, to continue to eat healthy the best you can. Grocery shopping isn't the easiest, but trying to be mindful of diet, eating 3 meals a day if that's what you're used to, um, engaging in some sort of physical activity, not being afraid to see the sun a little bit when it is out there. It is like we are entering springtime, and that can just that exposure to sunlight can be good for people. But also, I think it's important to acknowledge like any emotions, any stress, anxiety, or any other emotions really are completely normal to feel in this time, and to not be afraid to embrace that every once in a while and acknowledge that those are very real feelings, and that it's okay to feel that way, and to not be afraid to reach for help, whether that be public resources or personal connections, if helpful.
And talking about resources, the Brazilian community and Spanish community in this area, especially Taunton, Fall River, New Bedford, I thank everybody for for your support. Also, if you do know families in need, we have connections and support we can share with you guys, from soup kitchens to meals itself products. We have Taunton Catholic community that are being an amazing resource, and they have a food pantry there that are willing and ready to deliver their products to family that really need. So you can reach me at Sony Fernandez in Facebook. We also have Brazilian Association of South Coast Facebook. Or you can also find me on WhatsApp, in email, or you can also go to Business Innovation Center website. Yeah,
If I
we
could,
are
can
going
I
to.
jump in and help you with that? Just to share some of the things that we're doing over at the Business Innovation Center. First of all,
Absolutely.
that uh, that link should be at the bottom of our screen here. You'll see that businessinnovation.center, and we have a variety of programs that we're doing there. A streamathon to help folks in the gig economy. We're also starting what we're calling Soup for the Soul survival kits. We're accepting donate. We are a 501c3 organization. We're accepting donations for food and other supplies. Everything from we're including some toiletries, toilet paper and paper towels. We're including some food staples, rice and beans and that kind of thing, other food products. But we're also going to try and find things like hand sanitizer, Lysol. We're going to try, we have a group of people that are making masks. So we'll have some things that are really practical for that survival need. We have Blount Foods has donated some soups, which is fantastic. We're using our cafe, Thirsty Joe's Cafe, over on Columbia Street as a distribution center. So we'll be announcing those hours shortly. People can fill out a form. They can come and pick up. We'll communicate with them the best time. They can come and pick up the survival kit and get some hot soup while they do that. So if there's a family of 5, we'll give you 5 soups. If it's a couple, we'll give you 2 soups. Plus, there'll be soup in the care package as well. So you can come by and pick that up. If you are unable to get the food yourself, to come out of your house or to come over, you don't have transportation, there's a program, or there's a group of folks that have been driving immigrants to various appointments and so forth. So there's a drivers network that we're going to be trying to work with, and they will hopefully be able to deliver. I'm not sure of the times yet. We're still going to be working out those details. You're going to be able to find that information at either the businessinnovation.center website or thirstyjoescafe.com. We're going to put up some information in the next week or so we're still gathering our resources and assembling the team to help us put this together. But once we have that together, we're going to be pushing that out. And we'll be hopefully doing more programs like this every Saturday morning. We can get together and share more information. But that's something. Soup for the Soul survival kit. That's one of the things that we're doing with the Business Innovation Center. Sony and I are going to be kind of packaging that and connecting with various folks in the community. We also hope to partner with several of the churches as well. So that's just a little bit of, a little bit that we can do right now, and that's what we're trying to put together for everybody.
And I want to invite the public to join in on Facebook, and if you have any questions for Roy and Alex, feel free to join in our meetings and participate with suggestions, with whatever you have to offer. All right. So now, Alex, do you have any pointers or suggestions on how to relieve stress and wellness that our public can perform while stuck in the house? You're muted.
Oh, you're muted. Yep.
So similar to what Roy said, I think that just finding times to go outside if it's sunny and like getting some sunlight, as long as you're keeping 6 feet away from people. The CDC also does recommend now wearing a cloth mask if you have one while you're outside. Another thing is that a lot of these fitness apps and things like that are offering free trials and free months or 2 months. So you can have like the little workout app on your phone and it can lead you through an exercise video. That's what I've been doing to stay active at home. And I think it's been really helpful in just trying to keep myself moving when I'm in a small apartment. Other things, like Roy said, is just like thinking, like not being afraid to think about the things that are on your mind. And there are resources for telehealth available for psych treatment, psychology treatment. That's becoming more and more available, I think, during this time, because there's a recognized need for mental health care. So I think that is something that if you are struggling a lot with, to look online for those resources, because they probably do exist. Mm-hmm. And those are the big things, I would say.
Mm-hmm. Roy, would you be able to tell our audience, what would you suggest if they have to go out? What is your personal feeling about masks and how they can best protect themselves?
Right. So sorry.
No, sorry. I'm just...
the current recommendations right now from the CDC, and I believe the governor of Massachusetts just released a statement as well, is that people, if you are going outside, make sure that it is, aside from just getting that fresh air every once in a while, making sure that you're going outside with a purpose, be it like to get food or some other essential reason. And that wearing a mask definitely not only to offer some protection to yourself in case like there are droplets floating around, but especially because we know so many of us may be carrying the virus without knowing it and may just accidentally be coughing and spreading that virus. And so we really want to be mindful of the people around us, trying to keep that distance away from people who we don't live with at all times.
If I could make a point that I read about online related to the distance. When you're running, and it makes sense, if you're running, you're breathing heavy and you're pushing out at a greater pace than if you're just breathing normal, having a normal conversation. So they're suggesting in this research that I read that if you're running behind somebody, okay, you want to keep more than 6 feet. You want to kind of double that, because they're breathing quite a bit harder and those particles are flying further and faster, and just for safety, if you're running, just you're running behind somebody, well, if they've got it, you can get it at a distance of 6 feet. So I think, folks, it would be good to keep that in mind if you're outdoors doing activities, that accelerated breathing will accelerate the projectiles, if you will.
One would hope that if you're running in the woods far away from people, but good point.
Well, then you got ticks in the woods. We live, but
um,
that's it.
Alex, what there is so much out there as far as masks. Uh, what is the best and most simplistic suggestion that you have as far as masks? What's your idea on masks?
So based on what I've seen and what I've read, I think that the whole purpose of wearing a mask, if you're not, working in a place where you're exposed to the virus necessarily, is to protect other people if you are carrying the virus. So like Roy said, wearing a cloth mask is actually recommended, and there are places where you can get materials to make those masks for free. And like Sony said, they're actually working with somebody to distribute those masks if people need them. So as far as wearing a mask in public, a cloth mask is great because it's reusable and it's not taking resources away from healthcare workers in hospitals who need those masks in higher risk settings.
Absolutely. There's no excuse to see people out there without a mask, without protecting other people. And I have seen way too many people not taking this seriously. It is serious. We have, as yesterday, over 18,000 cases only in Massachusetts alone.
It's actually up to 20 this morning.
It is alarming. Right now is the peak, and if we go above the peak, there's no way. There's going to be harder to bring it down. And I went to Petco. There was nobody wearing masks, and people looking at me funny for having a mask. And
Yeah,
that's very
a scary
concerning.
I went to the gas station the other day, and I have the full facial mask with the little respirator, filters and everything, and I'm not afraid to wear it. At first I was a little like, hey, this is kind of overkill. Well, it's not, because it's protecting me and protecting other people, but it's also with the face mask, I can't touch my face. One of the things, if you're wearing a mask and you're trying to protect yourself, well, you go and adjust your mask and you just touched your face. So you really have to be careful and cognizant of where your hands are and in between the times, but it's really frightening that nobody's wearing a mask. I went there, I was the only one wearing a mask.
Thank you, Chris.
Up by the hot dog going like this, putting chili on it. And I'm like,
next time. Thank you for the chili. Thank you, Chris. Talking about hands and cross-contamination, Roy, how do you feel about gloves? What would you suggest for people that are going out thinking that they're protected? Oh, I have my gloves, and yet I'm touching my phone, I'm touching groceries, I'm touching everything. Oh, but guess what? I have mask on, gloves on. Can you tell us?
I think it's similar to what you're alluding to. It's important to remember that surfaces that we know that the coronavirus, COVID, can stay on surfaces for a few days, and obviously can make it from that surface to your glove, and from that glove to whatever you're touching. So just being cognizant when you're in public spaces to not be, one, for touching your own belongings, touching your face, but also like trying not to touch too many other things, and I guess bringing surfaces that wouldn't otherwise be in contact with each other together.
Do you find that gloves are kind of like a false sense of security?
I think as it's important to be mindful. I think gloves can be a useful tool in creating an extra barrier between your hands and whatever there's a reason we wear them in the hospital in many situations. It's just important to not let your putting on gloves in whatever situation take your mind off of the current situation.
Can you add to that, Alex, if you would?
I think Roy covered it pretty well. Just being mindful of the things that you're touching is really the most important thing, and touching as few things as possible, avoiding touching your face, washing your hands is actually probably a better way to protect yourself and other people than wearing gloves. So just remembering to wash your hands frequently, avoid touching your face, use hand sanitizer when you can, especially in public.
Do you have a favorite 20-second song that you like to sing for the, as they recommend, 20 seconds for washing your hands? What's your favorite song to sing for that?
So I've heard that Happy Birthday is the traditional one that's used, but I think that there was an app produced that has different songs you can play for 20 seconds now. I'm not sure what it was called, but I heard about it on the radio. So if you're getting over Happy Birthday, then definitely look into that.
We should look that up.
We should.
We'll put the link up somewhere.
So I am really honored and happy to embark in this adventure with the two of you. And I'm looking forward to meeting every Saturday, and hopefully we will have another channel of resource for the community out there. So I'm going to be sharing this with the groups that I am already in contact, and asking for their collaboration and help in bringing out and communicating that we are doing this. And if they have any questions, to send it to us by like Friday. This way, if we don't have the answer, if you guys don't have the answer, we can kind of do the research. All right.
We'll put some links up in the description so that people can follow along and connect with Sony on Facebook or wherever else. So if you're watching this video, you can look at the description links, and we'll put those in there. And we'll try and find a link to that app too for the 20-second songs. That'd be kind of fun.
I hope everybody stays safe and have a wonderful Easter. Take care of yourself and take care of others. That is the main goal. Thank you so much for all your participation.
All right.
Thank you, Sony, Roy, and Alex. Come back and check us out every Saturday morning for the Saturday Health Connection. Saturday Health Connection here at BIC Media Labs. Thank you so much for joining us.
Voila.
Voila. Ciao, ciao.